Today we have a challenging case for you. Are you ready to face the case? A 27-year-old right dominant male bilateral hand amputee underwent bilateral hand transplantation. Post-op complications on the left hand included ulnar and radial artery thrombosis solved by a humeroradial bypass, a full-thickness dorsal skin necrosis with exposure of tendons 2 through 5 and loss of peritendon, approximately 1% total body surface area defect, and a fatal attempt at closure with artificial dermis. The wound needs to be closed. How would you face the case? Your options are A. Artificial dermal matrix followed by skin graft, or B. Negative pressure wound therapy followed by free flap. The results are in, and most of you chose B. Let's see how the authors and Dr. J.P. Hong would face the case.
First of all, I'd like to congratulate the authors. This is a very difficult case and it was very well approached. However, I would have probably not waited until the full demarcation. When I see the early demarcation, I would have debrided it, put a vac on it for a couple of days, make sure that it started to granulate and it improves the overall status of the wound. And then I would have probably done a free flap. There's many advantages a free flap can bring. I would have probably used a hook up the free flap on the bypassed artery. We do that a lot in the diabetic foot as well. At the same time, I would have probably found a superficial vein to hook up the flap. Now, the pedicle approach is really a great approach as well. It ensures your success rate, but you have to think about the functionality of the hand, and whenever possible, consider early ambulation or early physiotherapy to the hand to maximize the function. So that's what would I have probably done. It is exciting and amazing to be living in the world today where plastic surgeons or reconstructive surgeons can take a hand from a generous donor and basically transplant to the patient who needs it. I think this is a demonstration of what science has really allowed us to do, enhancing the quality of life of a patient who did not have hands bilaterally. Of course, there are many challenges, but however, like shown in this case, where a defect had happened on the dorsum of the hand, we are able to overcome these challenges by the basic principles of using plastic surgery like flaps and grafts. So overall, I think we're in a new era where we are able to shed hope to these devastated patients. Please consult with your plastic surgeons around you if you or your loved ones have these kind of defects. This has been JP Hong from Seoul, Korea, taking part in Face the Case at PRS Global Open.com.